Hey everybody, welcome back. We're going to go ahead and do a training video now on how to properly place a knee immobilizer onto a patient. So the first thing you're going to want to do, you take the knee immobilizer out of the box and you're going to want to open up the knee immobilizer all the way so that no matter what size your patient is, it'll be ready to lay on the exam table, and you can adjust it as needed to fit properly onto the patient. I'm taking all the excess pieces off so we can start from scratch. So this is what it should look like on the outside when you're ready to go. This will be the inside, of course, and you're going to lay the leg down right down the center line. So once you have the patient's leg laying center down the knee immobilizer, lift up for a moment, you can see there's the center line. You make sure that their foot is straight up and down. You can customize the knee immobilizer if it's too large. In this case it is too large. This is a pediatric patient. So I'm going to go ahead and customize this for the patient. It doesn't matter which flap they fold over first, just so long as they don't have a bulk of flap underneath that's causing them problems. The next thing we'll do is we'll just kind of size it up. Looks like it's going to fit appropriately. We'll take one of the aluminum braces, we'll place it on the outer seam that would match where the pant seam would be, or in her case the short seam. You lay it on there and that's where it'll stay for all time. It'll stay there. The patient doesn't need to readjust that at all unless it's bothering them. You go ahead and do the inseam. Same thing. You rub it on there so it stays in place. And then what you do, you take your little friend here that looks like a scrap. You do the first flap. You do the second flap. And then you get your little friend and you put the Velcro right over the center of the knee to hold the two flaps together. That frees up your hands to do any kind of fine adjusting you need to do. So then once you have this nice and placed on exactly where it should be resting on the leg, you take the two straps that are closest to the knee and you do those two straps first. You hold the knee in place so that it doesn't shift around. Remember, they're here for a knee injury. You hold the knee in place, bring the strap about medium tight, and you Velcro it. I'll do the same thing on the strap that's just above the knee. This one will be easier to see. You hold the knee in place, bring the strap around, medium tight, and Velcro it. And that's how you do the straps. You want to be able to get your finger inside with a little bit of resistance. You go ahead and do the rest of the straps in the same manner. I'm going to reach into your space. I like to hold the two flaps so they don't come undone. Thank you, ma'am. And then the last strap that I do, the one here at the bottom, I tend to do this strap. Of all the straps, I do this one the most snug. And I do that so that the knee immobilizer does not slide down the leg when they're walking. And that is a knee immobilizer placed properly. And as you can see, the knee immobilizer keeps the patient from bending their knee. They can still use their foot and their ankle, but they're going to kind of have that piratey kind of walk. And that is all. Thank you.